The information presented in this video is for educational purposes only and should not be considered as medical advice. Always consult with a qualified healthcare professional before making any changes to your diet, exercise, routine, or health practices. The content is based on personal experiences and research, but it may not be suitable for everyone. Neither the presenter, myself, nor this channel is responsible for any adverse effects or outcomes resulting from the use of the information provided. Please do your own research and consult a professional for any specific health concerns.
The vagus nerve can be impaired by compression syndromes and damage, and sometimes these are the same problem, but let's look at chemical causes of damage to the vagus nerve. Now, one of the things that I often reference is drugs first, because there are many medications that have not been well studied enough to know their effects on the autonomic nervous system. But we can say for sure that there are certain types that have been linked quite well to disruption of vagal tone. And the first one is antidepressants. We know that SNRIs and SSRIs are all linked to lower vagal tone. And we also find that benzodiazepine drugs have also been heavily linked to problems with the autonomic nervous system. Additional to that, you probably will find that in certain circumstances, particularly medications that are involved in increasing alertness may do the same, and asthma drugs and anything corticosteroid based may negatively affect vagal function. It may not damage the nerve in those cases, but it will impair function. Another known cause of vagus nerve damage is vaccines. Vaccines, particularly the current mRNA vaccines, have been heavily linked to vagus nerve and more broadly nervous system problems. In fact, some of the known neurological side effects now, according to a paper by Garg and Palawal, 2021, we now know that the mRNA vaccines are associated, if not causing, cerebrovenous sinus thrombosis, Bell's palsy, acute transverse myelitis, acute disseminated encephalomyelitis, acute demyelinating polyneuropathy like Guillain-Barré syndrome, shingles, headaches, and functional neurological disorders, all of which can be attributed to nerve damage. Now, they haven't mentioned the vagus nerve there, but the vagus nerve is often an effect within that, but also could be isolated as well. And because vagus nerve and autonomic disruption is not well discussed in the literature, it's often not examined or even looked at as part of that picture. So definitely we know that the vaccines are involved. In fact, there are 11 studies here you can see that have been linked, vaccines have been linked to dysautonomic symptoms. So it's looking pretty frightening when it comes to the vaccine. Now, that's not the only cause. You also have the normal causes, which we are essentially neurotoxins we're exposed to on a day-to-day basis. And they come from air pollution, water pollution, and food contamination. And these are mostly things like vehicle exhausts, brake dust, weather modification, things like silver in the air. And unfortunately, silver is heavily linked to problems with the vagus nerve. Industrial production of exhaust and other chemicals that are in the air, farming practices, and there are of course many other sources. Sometimes they're actually to do with the work that you're doing. So if you're, for example, someone who works in gardening and you're using organophosphates, you might be exposed quite a lot to that and therefore get neurological problems such as vagus nerve disruption, or a hairdresser because you're using chemicals all day. Anything where there's chemicals involved, you may well have an effect on your nervous system that's quite negative. Other known neurotoxins, so these are the ones, if you're exposed to them, you're most certainly negatively affected. So we have acrylamide. This tends to be more of an occupational exposure. Acrylonitrile, again, occupational exposure, environmental exposure via manufacturing plants and cigarette smoke. Arsenic is quite well contaminated. Rice is contaminated with arsenic in most cases, so highly recommend looking into getting only rice that is grown in Italy or Australia. As far as I'm aware, they're the lowest. And there's lots of arsenic in air as far as I'm aware from car brakes and the exhaust, unfortunately. Benzene, occupational exposure, tobacco smoke, environmental exposure from industrial emissions and motor vehicle exhaust, and also from different solvents, depending on what job you do. Lead, methyl mercury, organophosphates already mentioned, and PCBs. All of these are defined as known definite neurotoxins, whereas there are many other neurotoxins where they're just considered potential. So there are many ways of which your vagus nerve can be damaged, and most of the reasons are to do with the air, the water, and the food. And so I often recommend to my patients that you have an air purifier at home, that the job that you're working in, often they will need to change professions in order to get better. If that job is heavily associated with chemical exposure or certain dust exposures, and also that your water supply is as clean as possible. So I have distilled water, but many people use reverse osmosis, which is effective too. And that your food is washed and it's organic. And that's another reason why a lot of people have good results from eating predominantly meat and less vegetables, is because most of the heavy metals are found in vegetables, grains, and seeds. So the heavy metal exposure with vegetables, grains, and seeds is often why people are intolerant to them. It's not to do with all these other anti-nutrients that they often talk about. Fruit and meat and dairy have the lowest levels of these, so they're often associated with less reactions.